So today's topic is nutritional and food requirements of preschoolers, that is, children between the age of 1 and 6 year old. Okay, so those who have the textbook, it's on page number 88 onwards, your dietetics textbook, new edition. There may be slight variation in the page numbers. So please put the page number in the chat box, those who have the textbook. Nutritional and food recommendations for preschoolers. So preschool children, when they constitute 20% of India's population, entire population, challenge you as a parent, as a guardian, you will see here is you have to establish a good healthy eating habits and feeding habits in this particular age, because it more or less it will affect the entire childhood as well as the teenage of the child. Okay, so establishing a good eating habit, making the child eat the right kind of food at the right time is very important. It's the responsibility of the guardian or the parents. So directly coming to the nutritional requirements. Okay, one by one we'll see what are the exact nutritional requirements. Quantitatively, you will require for preschool children energy when they are under 3 years of age, 1 to 3 years of age, around 1110 kilocalories. On the slide, it is given 1060, but according to the new RDA, slightly increased energy is required for today's kids. Okay, according to the ICMR data of 2020, it's 110 kilocalories for children who are between 1 to 3 years of age, and 106, 360 or 350, just more or less 10 kilocalories, not a big deal, then 10 calorie difference. So that is required for children who are between the age of 4 to 6 years of age. Okay, so this is the energy requirement, because again the focus here is on growth. A lot of energy will be used up in making the child grow to reach the childhood milestones. And if the food is insufficient, it will lead to undernutrition. It will not give adequate weight gain for the child. Height will not improve. Okay, the child will grow, but the height will increase at a very poor rate. Okay, usually up to 10 years of age, there is no difference in the kilocalories required by a boy child or a girl child up till the age of 10. Okay, and as soon as puberty starts, as soon as teenage starts, there will be changes for male child and female child in terms of calorie requirement. Okay, the types of food and all we will discuss in this chapter later. And if the child is not able to meet their calorie and protein requirement in a long term, it will lead to severe acute malnutrition at this phase of life. Okay, if the age of the child is less than 1 year of age or less than 3 years of age, usually it is marasmus. And when the child is above 3 years of age and if the child is struck by malnutrition, it usually leads to kwashiorkor. Okay, protein requirement is 1.3 gram of protein per kg body weight. Having 2 whole glasses of milk, giving a child 2 whole glasses of milk once in the early morning and in the evening. Okay, if you give make the child drink 2 whole glass of milk throughout the day, a lot of protein requirement will be taken care of. Okay. And according to the new ICMR data, the protein requirement has slightly decreased. Okay, 0.8 to 0.9 gram per kg body weight is also fine. In the old data, in the previous data, it was 1.3 gram per kg body weight. Just go by the textbook. Your textbook has the recent, most latest RDA. Just go by the textbook. And as soon as the body size increases in children, okay, more tissues are formed, okay, organ sizes increases, there will be increased demand of protein as well. So the body has to keep up with the protein requirement. And even for bone growth, if the bone grows, if the skeletal system grows, the child's height will increase. Okay, so for bone growth as well, um, it is required, protein is required. Milk is the best source of protein and calcium and other vitamins and minerals as well. Okay, milk is considered as a milk and eggs are considered as complete food. Okay, because it gives you the majority of the food required, and milk is something you can flavor it up. You add Bonvita, Boost, okay, whatever flavor the child likes, you can make it into milkshakes. Okay, it is very versatile. Eggs and milk, it is very versatile to put into your day-to-day cooking needs. Okay, and very easily to make a child, just imagine uh, a glass of a whole glass of milk may be giving you around 10 to 15 gram of protein. Okay, and a plate full of food is giving you 10 to 15 gram of protein. Which do you think is easier for the child to gulp down? Is it a glass of milk or a plate full of food? Considering the age of the child, what do you think? Milk, right? The child will, usually the children are thirsty. Okay, the children are dehydrated, they are thirsty, they don't understand thirst like how we adults do. They play a lot, they run a lot, they don't understand thirst how how adults do. They don't usually ask for water. Okay, very rarely, once or twice a day they will ask for water when they are extremely thirsty. Otherwise, they don't know how to stay hydrated. Okay, so giving milk, it fulfills their hydration needs as well. Okay, using Horlicks and Bonvita is all fine for kids. Okay, sugar content, 25 gram of sugar content, don't go more than that. For a child, don't go for more than 15 gram or 20 gram of sugar. Okay, that it is completely fine. You don't have to go sugar free for kids. Kids can the kids can tolerate sugar pretty well, okay, than adults. Okay, protein powder and all is not required for children. Children have their different kind of uh, nutritional mixes available that you get, Pediasure and all. Okay, these kind of nutritional mixes that are catered to children. Okay, fats. So visible fat, kids can have up to 25 gram to 30 gram, 27 or 30 gram of visible fat on a daily basis. Make sure 25% of the child's total energy comes from fat. For example, if 1360 is the kilocalories, okay, calculate the 25% from 1360, whatever is the kilocalories, that much calories should come from fat. Okay, so 25% of energy can come from fat, remaining can come from carbohydrates and protein. So just to be on the safer side, don't go more than 30 gram of fat per day when you are dealing with kids, preschoolers. Okay, 25 to 30 is a good range. And it is shown that people have asked about Bonvita, Horlicks and all. Check for any food drinks or like nutritional drink mixes that you buy for the child. Okay, make sure does it has DHA and RAA, ARA. Okay, these are omega-3 fatty acids, essential fatty acids. I'm putting the short forms in the chat box. Okay. See if the brand of this nutritional mixes, milk mixes that you buy, does it contain DHA or ARA? Usually Bonvita, Horlicks and all, they market themselves also that it has DHA and ARA. Just check their ingredients if it has it or not. Okay, Pediasure and all. Okay, just check if they have DHA, ARA. It means it's good for infants as well. Okay. Calcium 500 to 550 mg per day. You can go up to 600 mg as well. In the previous ICMR data, it was 600 mg. The latest ICMR 2020, they have cut down 50 mg. But more or less, it is completely fine. Okay. So calcium requirements in children, it is required because bone formation is happening, growing. It's a growing period. Okay, bone formation happens throughout the adolescence as well. So all kind of dietary calcium is not completely absorbed. Okay, so and you have to focus more on calcium-rich food for children. Milk is the best source of calcium. Okay. So at least 2 glasses of milk on a daily basis you have to give. It will fulfill the protein requirement as well. Coming to the iron requirement. So usually 0.2 mg of iron on a daily basis is fine with children, not more than 0.5. 0.2 to 0.5 mg is completely fine as per the body weight of the child. And there are a lot of nutritional programs. Okay, child health program of government, they provide 20 microgram of elemental iron and 100 microgram of folic acid syrup is given, because if you're dealing with infants, you can't give tablets, you have to give it in syrup form. So these kind of programs are run to make sure the children's small kids, preschoolers iron requirements are met, because again iron, dietary iron is not completely absorbed and a lot of Indian food lacks good source of iron as well. We are majority of Indians are non-vegetarian, but majority of our diet is plant-based. Okay, majority of Indian population, if you see, majority of Indian populations are non-vegetarians. But even in non-vegetarians, they are still plant. Their major food source is still plant-based. A lot of vegetables, different kind of vegetables, staple food, cereals, pulses. Okay, non-vegetarians don't eat meat on a daily basis. In very rare households, it happens that you eat meat on a daily basis. Okay, so India has predominantly a plant-based diet, and bioavailability of iron from plant-based diets are pretty low. Okay, so considering that, we require these nutritional programs and nutritional aids from the government. Okay, to make sure young population are not deficient in these important micronutrients. Then vitamin A, 400 microgram is a safe limit. Okay, 390 to 510 is still a safe limit based on the recent data. And if the child is taking food supplement like Horlicks, Bonvita, okay, if anyone has Google, you can Google it right now. You can check it online right now. Does Horlicks, Bonvita, Boost, Milo, do they contain vitamin A or not? Okay, you can Google it right now and you can mention in the chat box for others to know. So usually these things, if they have to be sold in the market, they have to these food items, they have to fulfill certain criteria by the government. Okay. Did anyone check? Please mention in the chat box. Yes, Horlicks, Bonvita, okay, these things they are sugary food drinks. Okay, what you can do is you can cut down the use of white sugar that you use. Okay, majority of the food, packaged food you buy from outside, it will have refined sugar. Okay, it is very difficult to find a packaged food that does not have defined sugar. Okay, majority of it has sweeteners, it has refined sugar. The only thing that you can do is you can limit the white sugar that you use at your home. Okay, if you are making a nutritional drink using Bonvita, Horlicks, or something like Pediasure or anything like that for the child, mixing it with milk, cut down the sugar. Okay, cut down the white sugar, that is in your control. Okay, so giving the child milk, eggs, carrots, whole eggs. Okay, for kids whole eggs have to be given, carrots, green leafy vegetables. Okay, these things should be included in the diet to avoid vitamin A deficiency. Vitamin A deficiencies, we have a whole range of vitamin A deficiency. In next week, Monday class, we will be discussing that. Okay. Yeah, vitamin A, 750 mg microgram per 100 grams is present in these drinks, food drink mixes. So naturally, if by law you can't the food marketing that we do, whatever advertisements you see, okay, they are not supposed to misguide the audience. They go through a lot of checks. Okay, they go through a lot of filters, and then the final advertisements are shown on the TV. Okay, so next time when you see these advertisements, just see, or at least even if you go to a supermarket, you take a packet of Horlicks, Bonvita, just see on the top of the packet what all vitamins it is fortified with. Okay. Then B vitamins, when the child is taking regular cereals and pulses, okay, having a lot of groundnuts or peanuts. Kids usually like peanut butter also, okay, a sandwich with peanut butter or jam. A lot of their vitamin B requirements will be fulfilled. Vitamin E, sorry, vitamin D again, having milk on a daily basis and exposing the child to sunlight. That means encouraging the child to go and play out. Okay. If it is bright sunlight, when do you get bright sunlight? After 10 a.m. till 4 p.m. Okay. That's the time in India. Usually that is the time when you get bright, the brightest sunlight, especially at noon, 12 to 2 p.m. and all, sun is at its brightest. Okay, so if you allow the child to be out in this bright sunlight even for 5 minutes, wearing light cotton, not heavy cotton, light cotton without sunscreen for 5 minutes in the sunlight, their vitamin D requirements will be fulfilled. So this is about the nutritional requirements. Is it clear to all? Coming to the food requirements, okay, when food requirements, focus on the guidelines here. So the guardians and the parents, they are completely responsible on what type of food they are going to feed the child, at what intervals, okay. Underfeeding, overfeeding, okay, it completely depends upon parents' choices, okay, their vigilance. Children are usually born with the ability to self regulate their energy needs. Okay. So don't try to force feed the child. Never try to force feed the child. Children kind of have an ability to say they're completely full, they can no longer eat. Okay. When you force feed the child, sometimes it can lead to some health hazards as well, like choking on the food, okay, vomiting, aspiration. Okay. And developing a bad relationship with food, a negative relationship with food. When they know it's their dinner time, lunch time, they run away. Okay, they give a difficult time for their parents. Their parents have to run behind them and catch them. Okay, so never try to force feed the child. When they say that they are full, you have to respect that. You have to understand and respect that. And try not to showcase a full a large portion of food to your child when you are feeding them. Okay, avoid showing large portions of food because that will lead to a tendency of overeating. Then all food groups should be involved. Can you name the 5 food groups? Any previous past students who are still continuing the class, can you name the 5 food groups? What do you think comes under food groups? No, protein is not a food group. Protein is a macronutrient. Carbohydrates, protein, these are not food groups. Yes, cereals, pulses, vegetables and fruits, milk, milk products, fats. Okay, fats in the sense oils. Okay, oils and sugar. This is how you make food groups. 5 food groups. Okay, vegetables and fruits, milk, meat products, pulses, and cereals. Okay, so these are the 5 food groups. So food from all these 5 food groups should be involved in the child's diet on a daily basis. Okay, so daily one fruit should be given to the child, daily vegetables, some form of cereals and pulses. Okay, should be given to the child. Quantity and quality adequacy should be maintained. Quality food, quality food and quantity adequacy means avoid large portions. Start with small portions. Wait for the child to ask more. Okay, and give more small portions to the child. Encourage the child to ask for more food if they want. Okay, eventually when they stop asking, they understand they are completely full, they don't want to eat anymore. Okay, so that is quality and quantity adequacy. Proper elimination, you have to notice if the child is following proper elimination, like on a daily diet of fruits and vegetables, they will not have constipation. Okay, fiber rich food, if it is given to the child, they will not suffer from constipation. See how many times the child is using the loo. Okay, how well is your child potty trained and all. Okay, millets can be given to kids. Okay, even like ragi is a millet. Ragi is a millet and it is kind of a power food that we give to the malted ragi is something that we give to the child. You can malt the millets. Okay, malting means take the millet, wash it, wet it properly, let it sprout in a dark room. Once the millets have started sprouting, sun dry it. Okay. Once the sprouted millets are sun dried, you can powder it. Okay. Grind it, make it into a fine powder and use it as malt. Okay. Mix it in milk and give it to the child. Okay. So millets, you can malt it and give it to the child. That will take care of the protein requirement as well. Okay. Make the food interesting, with full of variety, attractive, colorful. Okay. If they have choices in their plates, it is easier for them to pick and choose what they write, what they feel like eating. Also include curd as much as possible. Avoid making the child eat in front of the TV. Okay, avoid a TV or smartphone. Don't keep the child near any electronic gadgets while eating the food. Let them concentrate on the plate first. And like how can you make the food more attractive, basic food attractive? Like add vegetable puree like beetroot puree into the atta. Okay. Or if you're making idli or dosa, add pureed carrot, pureed vegetables, or pureed spinach into the batter, and different color idli or dosas you can make. Okay, so plate will look very interesting and very colorful. So these kind of techniques, and the same thing adults can also eat. It's not only for children. When you're making an idli dosa and you're putting beetroot puree or carrot puree into the idli dosa batter, it is much more healthier for adults as well. Okay. If the child does not have the problem of eating overnight soaked and boiled millets, if they don't if they like the taste of it, it's fine. Otherwise, why we go for malt is that you can control the taste factor with malt. Okay, just add it into milk, put some jaggery. Okay, for sweetness, add it into some vegetable clear soup, boil it, and then give to the child. It is much more, when it is in a powder form, it is much more versatile. Okay. You can make porridges out of this malt and give to the child. So that is, since it is more versatile in nature, when you're feeding a child, you need versatility with the type of food that you use. Okay. So that's the reason why we usually prefer malted millets for, and also some cereals, even wheat and all. Wheat is also malted in the same form and then given to the child for weaning purposes. Try to avoid giving unripe bananas and apples, and discourage processed and junk food as much as possible. Majority of the food must be served from the family pot, which means whatever the family is eating as adults, majority of the food should come from family pot, and some treats here and there since they are kids. Okay, kids will have some special needs like their special drinks, some gummies, a piece of cake. Okay, something like that. A good treat that they look forward to. Okay, something good, some fryams and all. They can look forward to eating. Okay, finger foods, sandwiches. Okay. Especially for the child, something special is being made. But majority of the food should come from the family pot, what is made for the entire family. Different cooking methods should be used. As much as possible, make the food attractive as possible. If the child dislikes some food, some vegetables and fruits, if the child dislikes it, puree it, make a smoothie of it. Okay, if it is a fruit that the child does not like, make a smoothie of it with other fruits. Okay. So the main purpose is that vitamins and minerals should go inside the child. Okay, in any form, if it comes in any form, even if it is vegetable that the child dislikes, boil it, puree it, add it into soup, add it into dal. Okay, and then give it to the child. Okay, so use these kind of tricks. And whoever is feeding a food to the child, okay, mother or father should not show any dislike to the food. Okay, if one of the parent is not is a vegetarian, the other parent is non-vegetarian, and they have decided that the child will also be non-vegetarian. Okay, so when a vegetarian parent is feeding non-vegetarian food to the child, okay, don't make any faces against that food, because children are quick learners, they are very sensitive to gestures. Okay, so don't make any negative gestures when you are the one who is feeding the child. Okay. Nuts can be used as snacks also. And also never force the child to eat more than what they can take. Coming to the feeding problems, common feeding problems in children. First is dental decay, because too much of sugar. Okay, eating too much of candies, too much of chocolates. Okay, getting spoiled over chocolates, candy, something sweet, and on top of that they are not following proper dental hygiene. Usually the dental hygiene of the children below the age of 6 is usually parents responsibility. They have to make sure the child is brushing every day, night and day, before food, after food, rinsing the mouth, very important. Okay, even if the child is brushing the teeth once, it is fine, but if the child is not rinsing their mouth after eating food or after eating anything sweet, not rinsing the mouth, okay, that is also causing dental disease. And if the child's calcium intake is poor, vitamin D intake is poor, okay, it will accelerate dental disease. Too much of cheese in the food. Too much of cheese in the food. Milk and nuts can be given in form of milkshakes. It is calorie dense and energy dense. Make sure that you put the habit of brushing the teeth twice daily, morning and before going to bed. Rinse the mouth with water after every meal. Try avoid giving children sticky chocolates. Okay, like some of the chocolates like eclairs and all, they are very sticky in nature, which usually has caramelized caramel based chocolates and candies. They are quite sticky in nature, like 5 star and all. Okay, quite sticky in nature. The texture of the chocolate itself is very sticky, so try it, avoid giving these kind of chocolates. Then we have pica. Pica means your child will have this uh, urge to eat unedible substances. Like, it's very common in toddlers as well as preschoolers to eat chalk. Okay, when you start uh, nowadays, I don't know parents if they use the same slate and chalk to teach alphabets. Okay, but it is very common. Has anyone witnessed this in their nephews, nieces, or children? Okay, if you expose the children to slate and chalk, they have the tendency to eat chalk pieces you use on slates. Okay, so this is the reason, this is called pica. Okay, sometimes they want to eat ice, charcoal. If you can't put them on soil because they will eat the soil. Okay, they have a tendency to eat soil. Some metals, nails, blades, okay, paint. So these when you want to, when a child, not just in children but also in adults, when you feel like eating the non-nutrient substances, it's usually kind of a deficiency. It's a sign of deficiency of minerals. Okay, micromineral deficiency, it points towards micromineral deficiency, or either mental deprivation, parental deprivation, family is disorganized, low socioeconomic status. Okay, so these all are the
some of the causes associated with pica, apart from some micromineral deficiencies. Feeding disorders. So, usually, a lot of feeding disorders can be seen in a single child, or some children will have one kind of feeding disorder, like dysphagia. They can't swallow the food properly. They have pain during swallowing. Okay, refusing the food. Um, they when they eat on their own, they will not eat at all. Okay, only if somebody else is feeding them, they can complete the meal. Just by looking at the volume of the food, they will refuse it. Okay, a plate full of two chapatis and some curry, they will not eat it. But you give only half a chapati and a little bit of curry, they will be eager to finish it. Okay, choking while eating any hard food, they may choke on the food. Gagging and emesis as well. Emesis means vomiting. Something is stuck in their throat, they will vomit it out. Overfeeding also leads to vomiting. So these all are feeding disorders, food reluctance and all, usually towards vegetable. Okay, when they see something green vegetable, they don't want to eat it. So usually it could lead to some nutritional deficiencies as well. And when a young child is suffering from nutritional deficiency, when they grow up, they may suffer from other forms of other disease conditions like stunted growth, malnutrition, psychosocial problems. Any chronic health diseases can set in. Then we have a picky eating disorder. Picky eater is a child who only eats a very limited number of food. Okay, if it is dal and rice, they on a daily basis they want dal rice. They will not eat chapati. They will not eat any other cereal pulses. Okay, so this is like picky eating behavior. They do not want to even try new food. If you give them new food, they will decline it. They will not eat it. And some food groups, they will avoid it. Okay, like usually it is vegetables. Food groups entirely they will avoid vegetables, or in some children they will completely avoid all pulses and legumes. Okay, they have this strong preference of the food should be in a certain texture, in a certain color. Okay, some children will only eat food that is white in color. Okay, if even if it has little bit of red color because of chili powder or turmeric, they will not eat it. Okay, so these all are signs of a picky eater. And usually picky eating habit will wear off with time. You have to give it some time. Okay, because after a while the child themselves will get bored of the same food, same kind of food. Okay, but what you can do, since you can't force a child, encourage the child to eat along with adults. Don't make the child have a separate eating time alone. Okay, let the child watch others eating different kind of food. Okay, so usually when a child is sitting with the family and eating, a lot of food habits can be taught at this time. And give the child, even if it is a picky eater, give the child more home cooked food rather than outside food. And small portions of food should be given at regular intervals so that they don't overeat. Okay, some suggested recipes are given on page number 95, table 5.2. Okay, like preschool children, what all recipes you can try for the children. Idli fada, kuri paniyaram, that is like it's a South Indian dish. You can Google it. It is used by it is made with the same idli dosa batter. You add more vegetables into it and you shallow fry it. Okay, in a specific pan which has a lot of shallow holes. Dhokla, poha, noodles which is made of whole wheat flour, not the maida flour. Okay, pulses, sandwiches with a lot of colored vegetables. Okay, even idli dosa with vegetable purees, you can change the color of it. It will look more attractive. Milkshakes, fruit shakes, ice creams with fruit salad. Okay, chickpeas, peanut butter and jaggery. It's very healthy for children. Okay, so these recipes you can give to the child. So nutritional assessment, something very simple, even as a nutritionist or dietitian, you can also do, is to check the mid-arm as measurement. It only works for children under the age of 5. Okay, not for adults, teenagers. Okay, only the children who are under the age of 5 or under the age of 6, mid-arm measurement works to identify if the child is malnourished or not. Okay, so when you are finding out the mid-arm assessment, first, you have to find the length of the upper arm from shoulders to elbow. Find out the length. Divide it by 2. You will find the middle part of the middlemost part of the arm. There you have to place this tape. Okay, you can use any measuring tape also. If you don't have this specific tape, you can use any measuring tape and find out the mid arm circumference. Okay, if the mid arm measurement is less than 11, or if it is, even if it is less than 11.5, it means the child is malnourished. Okay, milk and fruit can go together. That's the idea concept of milkshakes. Okay, fruit shakes and milkshakes. It can make a food calorie dense. You can give a lot of calorie in small portions. Okay, so you can meet the calorie requirements of the children in small portions, and it is easier to feed. Okay, milk and fruits pureed together, it is very easy to feed. It has its own sweetness, and the child will finish the meal. The child will get their vitamins and minerals as well. Okay, to add more probiotics, you can add some yogurt also into this mix. So when you do the mid-arm measurement, if the mid-arm is less than 11.5 centimeter, you can see here in this child, okay, it's exactly at 11. It is showing you the red line, okay, which means the child is undernourished. Okay, on the right, on the left side, you can see it is still green, which means the child is well nourished. Okay, this is a malnourished child. So So, nutritional assessment has to be done first to identify, to rectify if the child has malnourishment or not, and if the child has malnourishment, which type of malnourishment. So, this is all completely different type of assessment, but basic assessment, mid-arm measurement, everyone should do. Okay, even though if you are not from a medical background, this is a measurement you can check. Okay. So this is the mid-arm measurement everyone can check. Apart from that, if you want to go into more detailed assessment, it is usually done by the pediatrician or nurses at hospital. Okay, or a person who is a clinical practitioner, they will do the further assessment. After the age of 4 months, okay, 4 months onwards, 4 to 5 months onwards, usually we will keep a 6 months age for the weaning to start, because if the child is malnourished at the weaning stage, it is much better easier for the child to recover. Okay, so nutritional problems of preschoolers: obesity. So usually, when the child is overfed by the family or mothers due to the wrong perception that if the child is not crying, you can feed the child more and more. Okay, and usually they have a perception that if the child is like well rounded, if the child is healthy and obese, means the child will not have any disease conditions. Okay, so that is a wrong perception. And mothers who force feed their children with high calorie food processed food, okay, rich in sweets and ghee, okay, that can also lead to obesity. And when a child is developing obesity at this young age of preschooling age, the child will naturally develop a lot of fat cells and adipose cells. Okay, and fat cells and adipose cells don't vanish easily over time. They stay in your body. They put you at a risk of continuing the obesity well into your school age and adolescence as well. Okay, so that is one theory of that is the fat cell theory of obesity. Okay, once you get obese under the age of 5, even at your childhood, when you are overweight or obese, you naturally have higher amount of fat cells, adipose cells, as compared to your own peers who are of your same age who are not obese. Okay, and fat cells and adipose cells don't vanish off easily; they stay in your body, giving room for more fat deposits to come in. Okay, so risk of obesity will always be there for a child who was once obese. So encourage the child for self feeding when to deal with obesity. Let the child feed themselves. Do not force feed the child. Make the child exercise regularly, like playing outside, moving a lot. Quality and quantity of the food that you give to the obese child should be controlled. Avoid giving calorie dense processed food, sweet food. Then we have protein energy malnutrition or severe acute malnutrition. There is a completely different chapter for this severe acute malnutrition. Different types of severe acute malnutrition, different types of formula diets that we use, 10-step strategies of management of severe acute malnutrition. Everything in detail we will study in that chapter. Okay. So they have given some explanations of kwashiorkor marasmus treatment, hospital treatment, and all treatment strategies are given here. You don't have to learn it right now because even some F75, F100 formula feed they have briefly given here, but in detail we take this chapter in nutrition science class. Okay. So this is kwashiorkor and marasmus. Marasmus usually happens in a child who is younger than 3 years of age. Kwashiorkor usually happens in a little bit older child, that is 3 to 6 years of age. Because kwashiorkor, the name meaning itself is elder child, disease of the elder child. Okay, that is kwashiorkor. So in kwashiorkor, there is edema, swelling all over the all over the body of the child. In marasmus, the child will lose fat, lose muscles, muscle wasting, severe muscle wasting and fat wasting is seen in marasmus. Okay, but fat wasting is not seen in kwashiorkor. Okay, here only protein is low. Protein deficiencies in seen in kwashiorkor. In marasmus, protein and energy both, okay, carbohydrates and proteins and fats, all three macronutrients are deficient in marasmus. Okay, and there are some clinical features like swelling of legs in kwashiorkor, sparse face, moon face. Why moon face? Because body is completely swollen up, so the face will appear like a complete circle moon. Okay, flaky appearance of the skin, swollen abdomen, ascites, thin muscles, but fat is present. Fat does not disappear. Okay. In marasmus, normal hair, but old man kind of a look because all the muscles and fat from the face has been vanished. Okay. So the face looks sunken in. So that gives off more age. Thin limbs with little muscle or no fat. All the bones are very prominent and visible. Okay, you can actually count all the ribs of the child. Body is weight is very underweight. Okay, severely malnourished. So we have a 10 steps treatment. Again, in detail, we will study about the 10 steps in um, severe acute malnutrition class. We'll just go through it. We usually have two phases, initial phase and rehabilitation phase. So as soon as you see a child who is in this situation, kwashiorkor or marasmus situation, when you take them to hospital, Immediately the initial phase of stabilization is done in the ICU. Okay, because the child may be suffering from hypoglycemia, hypothermia. The child's body temperature is very low, less than 30 degrees Celsius and all. Okay, so the body temperature is very low, and the blood sugar levels are also very low. And if there is any delay, the child may die off. Okay, so initial few days of stabilization is done in the ICU. Then the child is shifted into wards. Okay, and there also stabilization continues up till rehabilitation. Rehabilitation takes for several weeks, because in rehabilitation the child has to catch up whatever weight the child has lost. The child has to catch up those lost weight, lost growth also has to be catched up according to their age, according to the age of the peers. Okay, so WHO has given the 10 steps of recovery for malnourished children. So it comes in two phases: initial phase and rehabilitation phase. So first is hospital treatment and dietary management. In hospital treatment, as I mentioned, in ICU, hypoglycemia will be treated. The child will be put on intravenous fluids, okay, DNS and all, dextrose solution, normal saline, okay, these things will be put into the body. IV fluids will be started as early as possible. As soon as the child comes into the hospital, first of all, you will give, based on the child's age, you will give the child doses of high doses of vitamin A. Okay, if the child is less than 1 year of age, 1 lakh international unit of vitamin A. If the child is more than 1 year of age, 2 lakh international units of vitamin A. If the child is less than 6 months of age, 50,000 international unit of vitamin A. This is the prophylaxis that we give. Why? We want to prevent blindness. If the child is nutritionally so malnourished, obviously the child is malnourished in deficient in terms of vitamin A as well. It could lead to blindness. It could lead to nutritional blindness. To avoid that, the day one when the child is admitted in the hospital, give them the prophylaxis of vitamin A, okay, based on the age. Hypoglycemia will be treated, hypothermia will be treated. Definitely the child will have some infection, because such a malnourished child will have low immunity. Some infections will be there, some parasitic infection will be there. So start giving, based on the infection, start giving antimicrobials. If it is a bacterial infection, antibiotics will be given. A viral infection, antivirals will be given. If a parasitic infection is there, antiparasitic will be given. Anti-helminthic medications will be given. Okay, so hospital treatment will cover that. ICU, okay, ICU part, electrolyte dehydration will be corrected with IV fluids. Electrolyte imbalances will be corrected with ORS solution, Ringer lactate or ORS solution that will correct your electrolyte balance. If the child has infection, as I mentioned, antibiotics based on the infection. Feeding, you will not feed a lot because the child's health is compromised. Your priority is to save the life of the child. Nutrition comes secondary. So you will not dump a whole lot of food into the child. Slowly you have to start feeding the child. Okay, if you give a lot of protein rich food at this stage when the child is still in ICU, the child will go into a stage of shock. Okay, because to digest protein, also the body requires energy. Okay, so initially we will focus on carbohydrate rich food that intravenously the child will get a lot of glucose. Okay, and after ICU stage is done, slowly we will increase the protein intake. Okay, so in the ICU, F75 feed is given. In when child is out of ICU in the wards and all, F75 will be continued, and then F100 will be given. What is F75, F100? These are formula 75, formula 100. Formula 75 will give you 75 kilocalories per 100 ml. Formula 100 will give you 100 kilocalories per 100 ml. Okay. So that is the dietary management. And in dietary management, once the child is discharged after giving formula 75, formula 100, when you will go to formula 100, when you see the child is stabilized, the child is hungry, the child's appetite is coming back, child is asking for food, you will give formula 100. Okay, when the child is completely normal, okay, you will give formulas 100. Continue that along with home cooked food or the food that the hospital gives. Okay, solid food can be started. So once you start the solid food for these malnourished children, it has to be locally available staple food, inexpensive, easily digestible. At least 100 ml of milk on a daily basis should be given to the child if the patient can afford it. Cereal and pulse combinations in form of khichdi, pongal should be given. Formula 100 and Formula 75 are formula mixes. Okay. Ingredients is given on page number 101, table 5.3. F75 and F100 is given. You can check that how it is made. F100 has more protein as compared to F75. And when you come to rehabilitation, mothers will also be educated, family will be educated. In rehabilitation, when the child is discharged, the child has to follow up on a weekly basis to a PHC or a sub center or to the hospital. They have to come for follow up. Regular weight and height checking will be done. Weight gain will be observed. Typically, if the family is able to provide milk with fortified oil, khichdi, bread, eggs, and banana. Okay. If these five food is available for the child, weight gain can be re-established. So the rehabilitation can take place at home, at daycare centers, at hospitals, at community health centers. Okay, there are different centers where rehabilitation can be continued. And prevention, as I mentioned, food supplements like Ruffed ready to use therapeutic diet. Rough diet can be given. Rough diet, it comes in a package. Okay, you don't have to put it in fridge. Uh, you don't have to cook it. Okay, you just have to knead the packet a little bit to loosen it up. Open the packet and give it to the child. The child will eat it. It is like a chicky. Okay, it has peanut powdered peanut, jaggery, skimmed milk, vegetable oil. Okay, Ruffed is made up of all these things, and a lot of vitamins and mineral supplements is also added into Ruffed. Okay, so giving a rough diet and continuing the Ruffed for the children can make sure that the malnutrition will not bounce back. Health promotion, health education to the mothers, early diagnosis and treatment, making sure that community health workers have a surveillance system in the BPL areas, below poverty line areas. Okay, community health workers are working and surveilling each and every households which have children less than the age of 6, using the benefits of ICDS program, Integrated Child Development Scheme. Okay, using the benefits of these programs will also control malnutrition. The deficiency of vitamin A, it leads to blindness, as we have seen, but it does not blindness will not happen overnight. It happens in stages. Earlier in the first stage, it is night blindness. Okay, and finally when it is still not corrected, it will lead to xerophthalmic fundus from corneal ulceration onwards. Okay, corneal ulceration onwards till ophthalmic fundus, the whatever happens to the eyes, it cannot be reversed back. Okay, night blindness can be reversed back. Conjunctival cirrhosis can be reversed back. Dryness of the conjunctiva. Bite spots can be also reversed back. Corneal cirrhosis, within few hours, if it is treated, your vision can be saved. Okay, but after this, corneal ulceration onwards till ophthalmic fundus, okay, whatever you do, whatever treatment you do, uh, it cannot be reversed back. Okay, so this is a deficiency of vitamin A. In detail, we will study about these deficiencies of vitamin A in the next session. But you can understand the treatment of uh, vitamin A deficiency, xerophthalmia. Xerophthalmia means, zero means dryness. Okay, zero is related to dryness. Ophthalmia, eyes, dryness of the eyes, which is usually vitamin A deficiency. Okay, so immediately on diagnosis, or as soon as a malnourished child is brought into a hospital, immediately, if the child is less than 1 year of age, 1 lakh international units of vitamin A has to be given. How you will give it? A vitamin A syrup bottle is there. Okay, and it comes with a special spoon. Half a spoon, if you give, it means 1 lakh international unit. Full spoon, if you give it, it means 2 lakh international units. Okay, so the nurses know that. Whoever is giving the medication, whoever is administering this vitamin, they know that. Okay, so it comes with a special spoon. Next day, also same dosage you have to follow based on the age, and after 2 weeks, same dosage, and monthly once, even if the protein energy malnutrition or any form of malnutrition is resolved within 1 month, still this dosage should continue. Okay, the same if the child is below 1 year of age, 1 lakh, child is more than 2 years of age, 2 lakh international units of vitamin A should be given. And also in women, postnatal women, after giving birth, even in women, 2 lakh international units of vitamin A syrup is given to the woman within 45 days from the date of delivery. Same thing in children, twice a year, total 10 doses should be given to in Tamil Nadu, total 10 doses of vitamin A solution pre-calibrated, that is in a scoop, in a spoon, a special spoon comes for this syrup. Okay, that is a pre-calibrated measuring spoon. Okay, so in Tamil Nadu, 10 doses of vitamin A is given to the children, and for children up to the age of 6 to 12 months, 1 ml, that is half a spoon. Half a spoon automatically has about approximately 1 lakh international units of vitamin A. Okay, or even at the 6 month of age also, this can be given. After the first birthday, 2 ml will be given, but that is one entire spoon that automatically has 2 lakh international units of vitamin A. Okay, so when and all you will give this to the child? At the first birthday, when the child is 1.5 year of age, second birthday, 2.5 years of age, third birthday, 3.5 years of age, fourth birthday, 4.5, and fifth birthday. Okay, so once a year, sorry, twice a year, because for the birthday and the 6 months, after 6 months, so automatically twice a year, at 6 months interval, you will be giving the same dosage to the children. Okay, so this comes under the universal immunization schedule. Okay, the prophylaxis program. In India, and it began, this implementation begin in it started in Tamil Nadu, and then all over India it is adopted as well. So total 10 doses will be given. 10 doses of vitamin A will be given to a children up till the age of 5. And 1 dose is for postnatal women Every mother who have given birth within 45 days after birth, this prophylaxis has to be given to the mother as well. Is it clear to all the prophylaxis program for the prevention of blindness? So when you come across parents who have children who are under the age of 5, you can give this kind of health education to them. Is it clear to all? Next, feeding programs that we have in India. ICDS scheme. A lot of feeding programs comes under ICDS scheme. ICDS is Integrated Child Development Services. Okay, they fund a lot of nutritional programs in India. Okay, to safeguard women, to safeguard teenage girls, to safeguard school children, preschoolers. Okay, there are a lot of programs that they fund with the help of UNICEF. Okay, UNICEF and WHO. They also fund a lot of nutritional programs. Supplementary nutrition. Supplementary nutrition is not something that replaces your food. You have to take your meals, whatever meals you take on a daily basis, you have to take. Supplementary nutrition is what more you can add into it. Okay, so the rough diet that I told you, ready to use therapeutic food, okay, that is a supplementary nutrition. Preschool education, health and nutritional education to the mothers who are lactating and pregnant, immunization of children as well as pregnant and lactating mother, okay, regular health checkups, referral services if there is a complication in pregnancy, if it is a complicated pregnancy or a high risk pregnancy, okay, referral services should be used. So these all are the areas of work of ICDS program. Okay, they don't only focus on nutrition, they also establish immunization programs in different areas. Okay, they participate in polio program as well, other immunization programs as well. They conduct free health checkups with through PHCs, community health centers. Okay, they have pamphlets and booklets that they use in every public school for preschool education to teach the children about nutrition. Okay, so these all are the functions done by the ICDS program. Then we have the midday meal program. Preschool children are also beneficiaries of midday meal program. Midday meal program, as mentioned earlier, it was started in Tamil Nadu, and seeing the success of midday meal program all over India, it has been adapted. Preschool children will also benefit from it. Kids who go for Anganwadi, okay, in Anganwadi also meal is given to children. So it ensures decrease in school dropouts. Okay, at least to get one meal a day. Children from poor families are sent to school. Okay, because the parents know that at least one meal for the child will be given in the school. Okay, it encourages good nutrition in young girls as well. Okay, because of the gender bias. Good in school, when giving food to the girls and boys, there is no gender bias. Okay, up till the age of 10, girls and boys will require the same kind of nutrition. Okay, so up till after the age of 10 also, the midday meal content remains the same. Girls will be given more iron supplements, folic acid supplements from public schools. Okay, and the food that you use in midday meal, okay, it is locally available. Your staple food, whatever is the staple food of your region, that food is used. Okay, when you go to North Indian public schools, usually it will be wheat based. South Indian public schools, it will be rice based meal. Okay, even Akshay Patra, it's an NGO that also supports midday meal program. So in midday meal, usually this is how a midday meal is planned. Uh, Pulses, 100 grams for primary classes. Primary classes, first standard onwards, okay? First to fifth standard, and then upper primary class, and then secondary, higher secondary. Okay, so primary classes, 100 grams per student, 150 for upper primary classes, 150 gram per student. Pulses, 20 grams of pulse per student in primary classes, 30 gram of pulse per student for upper primary. This is how rationing is done. Okay, for school, at school level, based on how many kids you have and how much grams. This is uncooked food. Okay, uncooked food in grams, not cooked food. Uncooked food in grams. How many grams of cereals and pulses based on the age of the children, count of the children, how much total kgs or tons of pulses and legumes or vegetables and oils and fats you have to place order as a school. Okay, how much this will give you an idea. Okay, if your school has around 100 children, okay, if the school has 100 kids under primary, 200 kids under upper primary, okay, total 300 kids, you can calculate how much grams or how many kgs of food grains or pulses your school will require on a daily basis. Okay, accordingly rationing can be done. Okay, so that's about today's session. If you have any queries, you can mention in the chat box.